Hey everybody, welcome back to another episode of Pick Dr. Osborne's Brain. We've got a great show for you tonight. We're going to be talking about blood pressure, heart disease, natural remedies, and drug nutritional intervention interactions that can happen when you're taking medicines to reverse, or not really reverse, but to reduce the risk of developing stroke or heart attack. So a lot of things we're going to talk about. If you've got questions related to that topic, you know what to do. Go ahead and start pushing those questions in to the feed now so that I can do my best to get as many of those answered as possible. And if you're new to the Dr. Osborne show, make sure that you understand kind of the rules of the game. I like to know where you're from. I like to know where you're tuning in from. So say hello and let me know where you're coming from. We like to know how far we're reaching. And if you haven't already, make sure you visit us at glutenfreesociety.org. Sign up for our free gluten-free survival kit. It's a great tool that you can use to learn about navigating the gluten-free diet for those of you who aren't already following it and looking at what you need to be doing. So again, we're gonna get started with the show tonight. We've got lots of you chiming in. We've got Dorothy from Danville, Illinois, and Marianne from Gloucester, and Marie from Toronto, Canada, and Ruth's chiming in. Let's see here. Wanda from Tennessee, and Lynn from Australia, and Dawn from Michigan, and Angelina from Alabama. We got Pina from Staten Island, New York. And wow, lots of folks chiming in from lots of places. Love it. So again, keep feeding me. That's what feeds me. We got Hina from Carrollton, Dallas, Texas. We got Juan from St. Lucie, Florida. I was in St. Lucie last year for a conference. Juan had a good time there. We've got Luz from Winchester, California, and we've got Peggy from Redondo Beach. So again, I like this. Juan says, cut out grains, lower blood pressure, and reverse fatty liver. Yeah, I've seen that happen for a lot of people. And what we're really going to be talking about tonight is blood pressure, largely because it's a risk for heart disease, it's a risk for cardiovascular events like a stroke, a heart attack, etc. And a lot of people don't realize that blood pressure, there are a number of different causes for blood pressure going up in terms of your physiology, but very few doctors ever really go over that with their patients or clients. And so oftentimes what we're told with high blood pressure is take medicine, eat right, and exercise. But what does that really mean, eat right and exercise? You've heard me say this before. Eat right and exercise is a BS answer that a doctor usually gives when he's not got thorough knowledge about what eating right and what exercising really means. A doctor should have thorough knowledge of nutrition and should have thorough knowledge of what exercise means. What kind of exercise? Are we talking about yoga? Are we talking about aerobics? Are we talking about anaerobic activity? Are we talking about high intensity interval training? Are we talking about foam rolling? Are we talking about injury prevention? Are we talking about somebody who's in their 70s versus somebody who's in their 20s or their 30s? What kind of exercise and how that differs and how that varies from one person to the next? So the generic phrase eat right and exercise just doesn't work. And the medicines, one of the problems with the medicines, depending on which class of medicine, I actually wrote one of my thesis papers on how high blood pressure medications can actually cause nutritional deficiencies. So one of the big problems with the medications is they can cause vitamin and mineral deficiencies. So I'm going to walk you through a few different examples because I want this to make sense for you and I want you to be able to apply it. And I also want you to be able to, if you're taking a medicine for this, I want you to be able to go back to your doctor with this information and be able to have an intelligent conversation with that doc so that you can together work toward the benefit of your health. So let's use a couple of examples. I'm going to use example of one class of medications given to treat high blood pressure are the diuretics, and there are a number of different types of diuretics. There's things like Lasix, which is a very, very common one. Then there's another type of diuretic called hydrochlorothiazide, which is a HCT for those of you who might be taking that. These are diuretics, and what they cause is they lower blood pressure through water loss. So they lead to less water in the system, thus lowering or reducing the pressure, the pressure on the arterial walls as it's being measured, right? So diuretics cause water loss. So one of the the big issues here is if a diuretic causes water loss, in a sense, it's a form of dehydration, which we all know is not good for us. So taking diuretics long-term to manage blood pressure, which creates a form of dehydration, first and foremost, water, you're 70% water, and if you're chronically dehydrating yourself for the sake of lowering your blood pressure, it doesn't make a whole lot of sense. Now, one of the other things that diuretics cause, they can cause potassium, magnesium, calcium, and zinc deficiencies, meaning they can cause the loss of these minerals through the urine. Through the excess diuresis, they can create a mineral deficit issue. That's why certain diuretics, when a doctor prescribes them, they also prescribe potassium because they know that those drugs can create potassium deficiency, which can actually cause heart disease. Remember, potassium loss causes heart electrolyte disturbance because potassium is an electrolyte. Potassium, magnesium, and calcium are all electrolytes, and so they play a role in the way the heart contracts and the way the blood vessels themselves. Remember, the blood vessels are muscles. They contract, relax, and so if we are taking a diuretic in the name of lowering blood pressure that's creating spasm in the muscle, because what happens when we're electrolyte deficient? We develop muscle spasm. Well, the blood vessels are muscles. And so if the blood vessels start to spasm, we can actually increase the pressure through spasm. And this is oftentimes, a lot of times this is step one, is generally, and again, may not be your exact experience, but I've seen this time and time again with people, is diuretics are one of the first go-tos. And then when the diuretics start to create mineral loss, and that leads to a slow increase in the blood pressure again, then usually what happens is the person gets another prescribed drug. So they end up getting something like an ACE inhibitor, or an ARB, an angiotensin receptor blocker, or a calcium channel blocker. So these different meds all have different side effects, but one of the group classes of side effects with these types of medications is they can actually cause CoQ10 deficiency, and they can also, many of them will lead to zinc deficiency. And if you tuned in a couple of weeks ago, I talked about how ARBs actually can cause leaky gut. They cause gut damage. And that gut damage can lead to malnourishment, because one of the types of gut damage these drugs cause is villus atrophy, which leads to malabsorption of vitamins and minerals. So this one as a whole class causes malnutrition. These other ones have kind of select mechanisms of action. But I want to go back at this because I want to kind of walk you through. We're talking about lowering blood pressure. So here are the common meds and the classes of medications that are designed to help you lower your blood pressure. But the problem with this is they can create a nutritional deficit, and that nutritional deficit can actually be linked to an elevation in blood pressure. One of the things that we know, there's a series of studies in science, and these have been going on for several decades now. The series of studies are called the DASH studies. If you've ever heard of these, DASH studies have been ongoing for several decades. And the DASH studies, DASH stands for, it's an acronym. In medicine, we love these acronyms. Dietary Approaches to Stop Hypertension. So DASH, Dietary Approaches to Stop High Blood Pressure, basically, right? And these decades and decades of data that have been collected through the DASH studies, what do they show? They show that, this is a horrible marker, we're going to switch it out. They show that eating foods with too much salt, we're going to abbreviate that NaCl, and eat not enough foods with potassium and magnesium, so high foods with increased salt and low food quantities with potassium, abbreviated as a K+, and magnesium and calcium, causes high blood pressure. That's what these studies show, and it's all diet, meaning that when they take these patients that are eating high salt foods, high processed foods with lots of salt, and low vegetables and low fruits, when they reverse that and go high vegetables, higher fruit, and no processed salt, what ends up happening is their blood pressure normalizes. Now, when we say eat right, this is a great place to start. Okay, it's a great place to start just based on these DASH studies. But the thing about this, so what did we learn from this is that we learned that if you increase potassium, magnesium, and calcium, and lower salt, then your blood pressure is better regulated. Well, what did we just say? That if you're taking these medications, they cause magnesium, calcium, and zinc deficiency. How are you ever going to regulate your blood pressure properly? You're not. And that's the whole point. And that's why getting on one of these medications usually doesn't end. It leads to the next medicine, leads to the next medicine, leads to the next medicine. And what actually, at the end of the day, what you never really truly understand or know, if you follow that route, is why you have high blood pressure in the first place. Like, what causes high blood pressure? So we can dive into some of those as well. So again, the pattern for many people is they get a diagnosis of high blood pressure. They get put on medicines to lower the blood pressure. The medicines that are being used to lower the blood pressure actually cause nutritional deficiencies that can cause high blood pressure, so then they get on more medicines. And if we look at the next level of medicine down here, CoQ10 and zinc, one of the things that CoQ10 deficiency causes is it's actually been shown to cause congestive heart failure, CHF, congestive heart failure. It's actually CoQ10 deficiency also causes an increase in blood pressure. So does that make sense? I mean, make sense of it for me. I can't make sense of it. I can't make sense of justifying giving long-term medications that suppress nutrients that can actually regulate blood pressure unless there's a malignant high blood pressure scenario where your life is in such jeopardy or in such danger that if you don't take a medicine immediately that you are going to stroke out or you're going to have a heart attack. And that's very rare. Most people that go into the doctor with high blood pressure have had it for a few years, they're overweight, they're eating poorly, they're not exercising, and their diet's pretty bad. And that, again, the generic advice is eat right and exercise, but not to what degree of specificity, and not to, what does eat right mean? Because a lot of doctors have a belief, the same belief that a lot of patients have, which is to eat right means, you know, go and buy the healthy choice, like microwave dinners. That's healthy because the box is green. Like, that's the, for many doctors, that's their limitation in knowledge. They're no smarter about nutrition than you are. And actually, after watching this video, you'll probably be a lot more updated about nutrition and blood pressure than the average common doctor is. So again, this pattern doesn't make sense. The bigger question is, what causes high blood pressure? So really, what causes an increase in blood pressure? So let's talk a little bit about some of the things that can actually increase blood pressure, and that way you can start targeting and pinpointing some of the elements that are important that might have an effect. So I'm going to talk in big generalizations here. So one of the things that causes an increase in blood pressure is a reduction of oxygen to the brain predominantly. You have a receptor in your neck, in your carotid artery. You also have a receptor in your aortic artery that measures the amount of oxygen or the quantity of oxygen. Now, in the carotid, when that carotid artery is not receiving adequate oxygen, it sends a message to the heart to increase pressure. Why? Because the brain needs oxygen. The body has a mechanism to protect the brain. The brain needs oxygen, and when oxygen levels are low, okay, that message goes to the heart to increase pressure. So lack of O2 can lead to an increase in pressure because the brain is signaling the heart to get more oxygen to it. Now, if that's what's causing your high blood pressure, think about what that medicine's doing. That medicine is suppressing the oxygen getting to your brain by lowering the pressure, even though the body wants the pressure to be elevated to get more oxygen to the brain. That's counterintuitive to what the brain is actually asking for. And this is why a lot of people that go on these medications are really super tired and have a lot of brain fog, is because they're suppressing that mechanism. So not having enough oxygen can drive up blood pressure. One of the other things, number two, that can drive up blood pressure is low protein in the diet. Not getting enough protein in your diet causes, remember, one of the things that regulates blood pressure is something called osmotic pressure. It's the force that the proteins have on the blood vessel and the pressure on the wall. So low protein diets can actually drive up blood pressure. Now, I'm talking protein malnourishment more than I am somebody who just, if we think about protein requirement for the average person, to prevent this, I can give you like a little formula that you can calculate, but you know, when I say low protein diet, I mean less than 0.6 grams of protein. I'm getting geeky on you guys. per kilogram of body weight. So it's a kind of a calculation that you can do. And to get kilograms, you divide pounds by 2.2, and that gives you kilograms. But if you're eating less than 0.6 grams of protein per kilogram of body weight, you run that risk of being on a lower protein diet, and that could potentially elevate your blood pressure. One of the other things that can increase, well, let me back up just a minute because I want to elaborate a little bit on this. Particularly when I say low protein, one of the amino acids that regulates blood pressure, and this is somewhat of a different mechanism. There's an osmotic effect on blood pressure, meaning it's the effect that protein has on exerting a blood pressure effect. But then there's an amino acid called arginine. Now, arginine is found in protein, right? It's an amino acid, so it's a piece or building block of protein. But arginine forms a substance called nitric oxide. Nitric oxide is a vasodilator. So it opens up your blood vessels. Very important vasodilator. And if your low protein diet is also arginine deficient, this can happen too. So it's kind of, a low protein diet can hit you in two ways. One, it can adjust the protein regulated blood pressure, but it can also cause a lack of nitric oxide production, which leads to a tighter blood vessel, a blood vessel that's not properly dilating, and that can lead to an increase on pressure. This is if you've ever seen these commercials that are out on TV right now about beets and beet products. One of the reasons why beet products and beets themselves are so great is because they're very, very rich in natural forms of nitric oxide. So they help your body produce nitric oxide, and so that is, because it works as a vasodilator, is very, very healthy. So another reason to eat your vegetables, so to speak. But low protein diets can lead to an osmotic effect on blood pressure and can lead to, in this case, an arginine deficit that can also reduce your blood vessels' ability to dilate, which also increases pressure. Now, one of the other things that increases blood pressure is weight gain. And so we get people that are overweight. I mean, we look at the United States alone, we've got, at this point, I think it's 50 to 70% of the adult population is overweight. So what happens when you're overweight is your heart has to work harder to pump more blood to more of those fat cells and to more of those fat tissues. So weight gain, when you're overweight, increases blood pressure. And so what affects or ameliorates weight gain for many people, and not for all, but for many, is another cause, which is exercise or lack thereof. So we won't even really say exercise as much as we'll say sedentary lifestyles. How many people, and those of you who do, this fits you, like if I want to know if this fits you in the audience, if you work at a job where you sit for 8 hours or more a day, then you work a sedentary job. So if you work a sedentary job, just type in sedentary, okay? And I want to just kind of get an idea for how many of you are here, because this is a big, big problem. What happens with that lack of motion and movement is you will gain weight. Even if it's not rapid weight, you'll gain 2, 3, 4 pounds per year slowly over your adult life. And over enough time, that leads to, for many people, 20 to 30 pounds of weight gain, which can really create, an impact on heart health and blood pressure. So again, exercise or lack thereof, or sedentary, maybe you even exercise, but you're trading 8 hours for sitting a day for 30 minutes at a gym or 30 minutes of exercise. It's not a fair trade. 8 hours for 30 minutes, it's not equal, right? And so a lot of people don't realize that. They'll do 30 minutes of exercise, but they'll also sit 8 hours a day, and you've got to work into your day a greater degree of motion and movement than just that 8 hours of sedentary sitting, even more than just beyond walking to the water cooler, etc., to get a little bit of movement. So you've got to really work in some habits against sedentarianism here, or it's going to create a problem. Now, some of the other issues, so again, we got weight gain, which puts pressure on the heart and elevates blood pressure. We got a reduction of exercise. We've got a low protein diet. We've got low oxygen. These are some of the big, big causes of elevations in blood pressure. So, low oxygen can be caused by several factors. If we kind of back up to this one, and one of them is anemia. So many people are anemic, and that anemia is what leads to low oxygen. If you don't have red blood cell hemoglobin that can carry oxygen, then you're going to run low oxygen on a regular basis. So remember that anemia can be caused by iron deficiency. It can be caused by copper deficiency. It can be caused by B6 deficiency. It can be caused by folate and vitamin B12 deficiencies. So anemia, there's more than one kind of anemia. We can have what are called, well, we won't get into that. It's too, we'll get into that on a different day. So you can have a lot of different forms of nutritional anemias, which lower oxygen, which increase pressure. And if we suppress that mechanism through medications, then we actually are doing the opposite of what the body wants us to do. Even though our blood pressure is low, our brain is still suffering from oxygen deprivation. Many of you maybe have tried reducing your protein. We're coming out of, the keto diet is more popular today, but we're coming out of that 80s, 90s fads where high carbohydrate diets, low protein diets ruled the day. And a lot of doctors will still tell you low protein, low fat, high carbs to reduce heart disease, even though we know low protein diet will lead to, or can lead to, blood pressure problems through two different mechanisms. One, through the mechanism of the way that protein in your bloodstream actually regulates the pressure, called osmotic pressure. The other is through arginine deficit, which leads to vasoconstriction, or a tighter blood vessel. And then, of course, weight gain and sedentary behavior, sedentary lifestyle. So those are kind of four very, very simple things that can be analyzed by virtually any person with relative ease. It doesn't take rocket science to know whether you're overweight. It doesn't take rocket science to answer yourself honestly, are you doing this part? Are you doing your part? And it doesn't take rocket science to do this little calculation or this little formula to see whether that's happening. And of course, your doctor can rule out different forms of anemia. So if you're suffering with blood pressure problems, go ask them to check you for the different types of anemia and make sure that's not one of the cases or one of the core function or dysfunctions that you're suffering with. And then beyond that, we said over here the DASH studies. So if we look at, again, a diet high in sodium and processed foods and low in foods that are high in electrolytes like potassium and magnesium and calcium can also elevate blood pressure. So these things alone can be causes for blood pressure issues, which brings us kind of to a fifth cause, if you will. And that fifth cause is nutritional deficit. So anything that you do that creates nutritional deficit, whether it's a poor diet or whether it's you're taking other medications for other reasons that can prolongedly cause vitamin and mineral deficiencies, or whether it's you've got some type of pre-existing GI damage that's led to nutritional deficiencies, or if it's something like, for example, I said medications earlier, but like an antacid medication, for example, lowers your stomach acid, which reduces your ability to absorb vitamin B12 and calcium and magnesium. So, these are all just kind of reasons. Nutritional deficiencies are a category, but remember that nutritional deficiencies can be caused for a lot of different reasons. So we've got, these five. We can add one more to this list. I think we'll stop at one more. There are more, but we'll stop here, and that's stress. And so one of the things, I'm a big believer in honesty, and especially self-honesty, like asking yourself a question and answering yourself honestly and not lying to yourself. But do you love your job or do you hate your job? Like, this is a question that a lot of people lie to themselves about. They go to a job that slowly steals their soul year after year. It just beats them up year after year after year. And it creates a source of internal stress and internal strife. And that stress in and of itself can create a blood pressure issue. Having a boss you hate, having a job you hate, having a life that you're miserable in can create a lot of stress. And then, of course, there's just the regular stress in life. There's the ebbs and flows. There's the curveballs that life can throw us all. And so we all have to deal with those regular curveballs, so to speak. But ask yourself, what situations are you putting yourself in that create a scenario of chronic, unrelenting stress, that if you made different choices or changed your choice or positioned yourself differently, that you could alter that level of stress favorably and have an outcome on your blood pressure that was more favorable. So again, let's stop at these six. I think that's enough to chew on today, and I want to dive into some of your questions. So here we go. Yeah, lots of you typing in sedentary or sedentary. Okay, so Van Hutchinson says, statins. I'm getting qualified, valuable information from qualified science-based sources that statins do incredible harm via side effects, while the potential benefit has very weak science behind it. Look, I did a whole show on statins. If you want to go back in the Pick Dr. Osborne's Brain archive, you're absolutely right. I mean, the research on statins is so poor and so minimally scientific in my opinion, and in the opinion of many experts, and in the opinion of many researchers. As a matter of fact, there's a pharmaceutical number that is very rarely discussed. It's called an NNT value. NNT stands for numbers needed to treat. An NNT value tells you the efficacy of a drug, like how well does a drug work. And so statins, for example, have an NNT of 99, which basically means that for one person out of 100 to receive benefit on this drug, 99 people have to be taking the medication. And what does that really mean? That means one person out of 100 will receive a benefit from a statin, the other 99 will not. And what does that mean? If they're not receiving a benefit, then what are they actually receiving? Well, they're receiving a detriment, because statins don't come without cost. Statins block CoQ10. So going back to what I said earlier, CoQ10 deficiency can cause congestive heart failure and elevate your blood pressure. Well, the whole point of taking a statin is to reduce your risk of developing heart disease. But if taking a statin causes a nutritional deficiency that increases your risk of heart disease, again, does that make sense? Is that the best move for you? Is that the right move for you? So again, I'm glad you bring that up, Van, but we won't dive too much deeper into statin territory because we've talked about that before. So Wilma says, blood pressure spikes when my essential tremors appear, then it goes back to normal. So there's a different question, Wilma, that you need to get with your doctor and ask, and that is, why are you having essential tremors? I've seen cases where people developed essential tremor problems as a result of gluten sensitivity or gluten exposure. So really, get with your doctor and have them measured genetically for gluten sensitivity, not for celiac disease, for gluten sensitivity. I did a show on that about a week or two ago as well, on how to properly test for gluten sensitivity. So make sure you watch that and go have a conversation with your doctor, because if you're having essential tremors, it could very well be that you're gluten sensitive, and that's what's creating the tremors. Let's see here. Love that. Deborah's just confirming what I just said. So Deborah says, yep, my blood pressure went back down after I left my job. What blood pressure reading should be concerning? Joanne wants to know. Oh, I didn't even put that on there. Great question, Joanne. Let's get that answered for you. So there's two numbers when doctors are measuring blood pressure. There's what's referred to as the top number, which the top number is oftentimes referred to as systolic. So let's see here. Let me get my rag here and make some room. So we have a systolic pressure and that's the top number. And then we have a diastolic pressure, and that's the bottom number. Now, what's the difference between systolic and diastolic? Systolic is the amount of pressure on the arterial walls when your heart is beating. So it's at the point the heart is pumping or beating. And the diastolic is the pressure when the heart is at rest. So that's why the top number is higher than the bottom number. So the one to really be concerned about when when your doctor's diagnosing high blood pressure is diastolic. The diastolic, a normal range of diastolic is between 60 and 90. Now, some will say that 85 to 90 is kind of a pre-high blood pressure state. It depends on who you ask, but most doctors now are looking at 85 to 90 as kind of a pre, and a lot of them are making a recommendation to put you on medicines with the pre and not with over 90. But over 90, technically textbook, over 90 on the bottom is considered to be high blood pressure. On the top, the range is 100 to 140, meaning that anything over 140 is going to be considered to be high blood pressure. Now, again, there's a pre-range, and that's between 130 and 140 is what many are considering now to be pre. So what's high? 140 over 90 or higher is high. So if your blood pressure is coming back consistently higher than that, and the kind of the criteria for diagnosing high blood pressure is that you have to have 3 consecutive readings at a doctor's visit. So you go to your doctor, they measure the blood pressure's high one day, you come back, it's high another time, you come back, it's high another time. Generally, the criteria is that you have 3 consecutive elevations in blood pressure on 3 different doctor's office visits in order to meet the criteria of being diagnosed with hypertension. Now, that being said, a lot of people just go in, they have blood pressure that's high one day, and they get put on a medication. But really, it's supposed to be 3 consecutive elevations or 3 consecutive readings of high blood pressure. Now, something else to consider is the way that blood pressure is being taken. So a lot of times when you're in a doctor's office and they shuffle you from room to room, or they shuffle you down the hall and you're really stressed out, maybe you're coming through traffic to the doctor's office, they bring you back and they take your blood pressure, and you just got out of your car and you're really stressed. And they measure your blood pressure because you were just driving in traffic and it came back a little bit high. Always ask them when they're checking blood pressure, make sure that you're allowed to sit down and rest for, at least 3 to 5 minutes and kind of calm down, especially if you have been driving in traffic. Now, also, if you've been drinking caffeine, if you're a big coffee drinker, you drank a big old cup of coffee this morning and you pumped up your heart with caffeine, because caffeine is a stimulant and it will raise your blood pressure. So if you're pumped up on coffee this morning and you're getting your blood pressure reading, know that that could account for some elevation in blood pressure as well. Now, the third thing I would ask you when you're getting your blood pressure checked is make sure that when they're checking it, that they're checking your left arm, not your right arm, your left arm, and that when they're checking your left arm, that your arm itself is elevated to the level of the heart. So your arm elevated to the level of the heart, and that the arm itself is completely relaxed and at rest. In essence, don't hold your arm up and let them wrap that sleeve and take it while your muscles and your tone of your muscles are on, because that will raise your blood pressure. So blood pressure should always be measured at rest with the left arm, and the left arm should be at the level of the heart at rest, without tension in the muscles. That's where these numbers come from. So if we're going to be accurate in measuring it, it needs to be measured in that way so that you don't get a false elevation or a false high. So just make sure that you're, when you're going in, that you're paying attention and observing those things, because I've seen people that went in and they didn't really have high blood pressure, but they were still put on a medication simply because, the doctor wanted to prescribe it with one reading. Okay, let's see here. Yeah, white coat syndrome. Thanks Maxine for chiming in on that. So white coat syndrome is when the doctor's got the white coat and people are nervous when they're going to the doctor. They usually don't feel well and they're going to the doctor and they think, am I going to get a healthy checkup or not? And so they're really nervous, and that anxiousness, that tension, that stress, if you will, can elevate the pressure. So white coat syndrome is a very real thing. And so in that case, you might just try measuring it at home. To get you a good reader, get you a good blood pressure cuff, and measure at home consistently, and just kind of keep an eye on it. Okay, let's see here. Yeah, lots of you chiming in with some good takes. Blood pressure can go up when you're running a fever, when you're sick. Okay, so then we got this one here, which is Doug's chiming in. If you live in Canada, blood pressure over 120 on the top is actually considered to be high. They narrow the ranges because, in my opinion, this is my opinion, they narrow the ranges on cholesterol, they narrow the ranges on blood pressure, predominantly because it increases customer base. But again, that's my opinion. Okay, let's see here. CPAP. So somebody's chiming in and asking about CPAP. So it's like, that's another, we could put that as another cause, would be sleep deprivation or lack of sleep. Sleep deprivation, chronic sleep deprivation particularly, can create an increase in blood pressure. And some people have chronic sleep apnea, so they're waking up at night because they're not getting enough oxygen. So you think about that O2 piece, right? So a CPAP machine can be an effective way to get forced oxygen when you're sleeping. But the bigger question is, why, right? And I always go back to why. It's one thing to use a CPAP machine while you're trying to figure the why out, and there's nothing wrong with doing that. A CPAP can be perfectly fine. Although there's some CPAP machines get dirty, they run the risk of, upper airway infection. You get bacteria and other garbage growing on them if you're not cleaning them well. They don't come without total risk, but it's better than not sleeping, and it's certainly better than waking up with high blood pressure. So CPAP is something that, again, if your doctor prescribed it, it's not a bad idea. And but the real question is, where's the sleep apnea coming from? And for many people, sleep apnea comes back down to this. It comes back down to weight gain. A lot of people lose weight, and sleep apnea goes completely away. A lot of people correct their anemias, and sleep apnea completely goes away. So again, it depends on what's really creating or what's really causing it. So my mom has been taking blood pressure meds and developed GERD. What is the effect on the microbiome? And Gabrielle, I have not seen any research, and it doesn't mean it doesn't exist. I just haven't read any research that shows that blood pressure medicines per se directly impact the microbiome. Now, some blood pressure medicines that I have seen have fillers, and if, like, for example, corn-based or grain-based fillers. And so for some people can affect their microbiome, especially if they're gluten sensitive, because it's damaging their GI tract and creating an inflammatory response in the gut. That being said, the one that, again, going back to the one that we know can absolutely create a problem are the ARBs, because they cause direct gut damage, and that inflammation can impact and affect the microbiome. So it would be more of a kind of a which blood pressure medication is your mom taking, which class of medicine, as to whether or not it's affecting the microbiome directly. Now again, sometimes what happens with, and we can, again, directly, when I say directly, I mean the drug is directly impacting the microbiome. There's also indirect effects, and indirect would be like a diuretic, for example, doesn't damage the gut microbiome, but it causes a loss of electrolytes, and these loss of electrolytes can cause you to have a spastic colon, and that when you have a spastic colon consistently, it can lead to constipation and other problems with gastrointestinal motility, and gastrointestinal motility can affect the microbiome. So again, it's not a direct effect, it's an indirect effect as a result of electrolyte disturbance. So there are a number of different possibilities there for indirect effects, but as far as direct effects, the ARB are the only class that I could really point to that I have seen or read research studies that prove that blood pressure medications can directly affect the microbiome. Is low blood pressure as bad as high blood pressure? Mine is always 100/60, sometimes lower. No, it's not. It depends. For example, my blood pressure generally runs in the upper 90s and on the lower end in the 50s. But that's an athletic blood pressure. So if you're an athlete, if you train, if you do exercise very aggressively, regularly, if you run marathons, if you're a triathlete, if you're a CrossFitter, if you do exercise where your heart becomes more efficient, your pressure goes down, and that kind of lower pressure can be normal in an athlete. Now, if you're not an athlete and you're not exercising and your blood pressure is running low, and you find that especially when you like get up from a seated position and you stand up and you feel dizzy and you kind of have to catch yourself and you feel a little woozy, that could be something where your blood pressure is running too low. And some people don't get enough salt, and so with salt, we've all heard the war on salt. It's like, don't eat salt because it elevates your blood pressure, but some people take it too far and they eat no salt at all, and then their blood pressure can drop too low. Remember, you do need some salt to regulate your blood pressure. It's a very important electrolyte. Sodium chloride is very important, both two electrolytes, and so salt is important in regulating blood pressure, and you can go too far in one direction, and that's one of the common causes of blood pressure being too low. Of course, there are other causes, but that's one really common one that we see. Can gluten sensitivity affect blood pressure? It absolutely can. And Sally, anything that causes inflammation. So when we look at, we've got 6 different causes, right, for elevation of blood pressure. We could write in number 7 real easy, and we could put here inflammation. And gluten for many people causes inflammation. And inflammation, you understand that high blood pressure, actually some research studies show that it is a disease of too much chronic inflammation over time. And so we know that elevations in inflammation, and that includes eating foods that can create inflammation, and gluten is one of those big ones. If you're gluten sensitive and you're getting daily or regular gluten exposure, you are creating inflammation that can elevate your blood pressure. You know, I'm not the expert. Kimberly asks, how can you effectively clean a CPAP? You know, I'm not the expert in CPAP cleaning. They make a number of different machines. Some of them are UV light based, so they charge them with a UV light. There's ionized silver that can be used. Some people use like silver sprays, so like a homeopathic silver remedy. Silver's a natural antibiotic. Silver's a natural antibacterial, natural antiviral, a natural antifungal, so it can be an effective and safe way to help keep that machine clean. But again, I'm not the expert on that in that regard. You know, what I would suggest that you do is ask the doc who prescribed or ask the company who produced it and find out what they're recommending to clean it. And as long as it's not some, you know, super mega toxic Clorox or something along those lines, and you might ask them what the alternatives they recommend, because I don't want to recommend something to you and then it's not made for the actual CPAP mask, and that it would deteriorate the mask on accident because of a particular ingredient. So again, I don't want to tell you something in that regard and be wrong. Okay, let's see here. Okay, what other things can cause sleep apnea? Husband just got diagnosed and thinks the machine is a lifelong sentence. Yeah, I mean, there are a lot of things. Probably one of the bigger, and this is my experience, the bigger things that I have seen create and contribute to people's sleep apnea is, number one, is weight gain. So if your husband's overweight, you got to have a strategy to get the weight under control. Number two, it's infection in the sinus cavities or in the nose. So like an upper respiratory infection, an upper sinusitis, a chronic allergen. If you've got mold in your home, I've seen that be a chronic cause of sleep apnea, because mold can create swelling and create inflammation in the airway. If you've got a food allergen, I've seen food allergens create and cause sleep apnea for many people. So eating the wrong foods can again increase the swelling in the terminates, restricting airflow. So a lot of different things. My best advice I can give you in that regard is, if you're really trying to find the origin root cause of a sleep apnea in your husband, is get him to a functional medicine practitioner who will dive into what those different causes might be and get him a solid answer. Okay, Barb says, I'm skinny and have severe sleep apnea. Yeah, I mean, sleep apnea is not only caused by weight gain. You can be thin and have it for some of those other reasons. Food allergies, environmental allergens. You can have it because you're gluten sensitive. You can have it because you have an infection in your sinus cavities. Again, lots of reasons as to why it can happen. And you know, it just becomes an issue of measuring. Let's see here. I like that. Rebel Radius says, I'm a McDonald's virgin, never eaten this stuff. That's great. Let's see, natural, I can't make that out. Natural HI, I think. Can erosive gastritis, SIBO, food allergy sensitivities, and high secretory IgA cause hypertension? You know, all those things are you know, common with inflammation. And so theoretically, yeah, we could draw some conclusions as to how that could happen. I would focus more on the high secretory IgA. There's a condition called IgA nephropathy, and you might want to just go and have that checked out. IgA nephropathy, the kidneys help regulate blood pressure too. It's actually one of the organs that help us regulate blood pressure. And I've seen cases where gluten can cause IgA nephropathy, meaning it causes an IgA damage to the kidneys, which then can elevate subsequently the blood pressure. So IgA nephropathy is not an uncommon, it's not super common, but it also isn't uncommon It's a cause or can be caused as a result of gluten exposure. So that's where I would look in terms of those different diseases that you mentioned. Doug says, I'm fit, have good blood pressure. Why is my heart rate in the 50s at rest? That's a normal heart rate if you're in good shape. I've seen some athletes' heart rates at rest even be in the 40s. So, you know, if you're an athlete, again, heart rate, an average heart rate for a resting heart rate, we're talking about at rest, is between 60 and 90 beats per minute. And if you're an athlete, it can go as low as in the 40s, depending on what kind of athlete you are, if you're a premium athlete. And even if you're just kind of a good athlete, kind of home-based exercise, take care of yourself, it's not uncommon to have a pulse or heart rate in the 50s. Mine hovers around 52 to 54, so that's pretty typical. Yeah, appreciate Up the Music says many of the medications have lactose, and that's true. Many of these medications, if you have a problem with dairy, they do have dairy-based fillers, and you have to be careful of that as well. Okay, let's see. So Eva's asking about closed caption. Eva, after the show's done, we generally will transcribe the show, so we don't have closed caption in the live setting, but we do get those transcriptions uploaded. And so if you subscribe to our channel, if you subscribe to our YouTube channel, you'll get notifications. Also, if you go over to glutenfreesociety.org and subscribe to us there, you'll also get notifications on when those transcripts, those closed caption transcripts are ready. Love that. Linda says, my husband had high blood pressure. He started following the same protocol that you put me on, and now his blood pressure is back to normal. Thank you. Well, you're welcome. I'm glad that he's finding that diet change super helpful. Mary Ann says, what kind of salt do you recommend in the diet? Look, some of the meats, if you're eating meats, if you're not a vegetarian, do contain salt. But as far as like salting food, a good sea salt or a good Himalayan rock salt, both are going to be adequate to salt your foods. And so where you can get into trouble is some of the chemically washed salts, like your standard iodized salts. I know they're iodized to try to prevent goiter, but at the same time they're a bleach salt, and I don't really recommend them. Those are the ones that tend to create this scenario. This just like processed foods, that processed salt can oftentimes for many people create an increase in blood pressure. Let's see, Lynn says, can you explain high blood pressure caused by hormones from menopause? It is causing migraines. I have low blood pressure normally. So if that's a really deep question, because there's a number of different hormone pattern abnormalities that could potentially contribute to a blood pressure issue. It's not just menopause per se. It's not just low across the board, low estrogen, low progesterone, low testosterone. But there are a number of different patterns. For most women that I see going through menopause, it's not even really an estrogen, progesterone, testosterone problem as much as it can be an adrenal dysfunction. So adrenal fatigue or the adrenal glands and the cortisol and the adrenaline and some of the mineral corticoids secreted by your adrenal glands are not being properly monitored or regulated. There's some nutritional issues or nutritional problems revolving around that can create hormonal disruption in that regard. My advice to you, I'm sorry I can't answer it better than that, Lynn, but would be to get with the doc and have those things looked at a little bit more aggressively. Okay. Best way to get iodine in your diet, eat seafood. And that's just with what you eat. Eat fish from the ocean, eat kelp, eat seaweed. Those are great sources of iodine from a diet if you're talking just food. Okay, let's see here. Question coming in, is psyllium husk okay? Is psyllium husk okay? Generally speaking, yeah, psyllium husk is fine. It's actually one of the ingredients that we have in our warrior bread. For those of you who've not tried warrior bread, it's a great grain-free, low glycemic bread that's high fiber, that tastes very, very similar to regular bread. And anyway, psyllium husk is a good fiber source. There's really not a whole lot that can be said that's terrible about psyllium husk, especially if your diet's low in fiber and you're trying to get some type of supplemental fiber into your diet. But it's great for water and bringing water into the bowels and for feeding your microbiome. It's a great fiber for that. Okay. Can high blood pressure be caused by low calcium, magnesium levels, or clogged arteries in the kidneys? So yes and yes. Anytime you have, well, first of all, what does clogged arteries in the kidneys mean? So a lot of doctors, a lot of people will say that cholesterol elevations can cause clogged arteries, but really inflammation is what causes clogged arteries. It's what causes calcium plaquing and cholesterol plaquing to actually start occurring in the arterial lining, which can lead to that clogging-like effect. So inflammation, really not so much cholesterol. But the question was, can a clogged artery cause an elevation in blood pressure? Yeah, it can, because it troubles the blood viscosity. Anytime you have less space, remember the blood vessel itself as a circumferential area, there's a certain quantity of space and that blood is pumping through there. Well, if you create a lot of clogging, if you create a lot of debris or clogging, or you narrow the airway as a result of clogging, then yes, you're going to increase the pressure on those walls. One of the other things that happens is as the body will deposit calcium and other minerals into a plaque, it stiffens the arterial lining, and that stiffening can increase blood pressure as well. So it's just another one of those things. Some people, if you ever read the work of Dr. Abram Hoffer, Dr. Linus Pauling, these are great orthomolecular thinkers. These doctors would have people with these types of issues taking high doses of niacin and high doses of vitamin C, because it was found to be quite effective at removing clogs in the arteries. As far as low calcium and low magnesium levels, yeah, that's what we were talking about earlier, is that magnesium and calcium deficiency itself, remember, they're electrolytes. What happens when you have magnesium and calcium deficiency? Vasospasm, muscle spasm. Your heart's a muscle, your blood vessels are muscles. If they're chronically in a spasm mode, or if they're spasming on a regular basis, then yes, you can get an increase in blood pressure as a result of that. If you've ever seen, the perfect example, somebody who has a stroke or a heart attack and their arteries are completely clean, like they do the Doppler test and there's no clogging, there's no arterial debris, there's nothing like that. These are, in some of these cases, perfect example, in some of these cases, these are people with, long-term calcium, magnesium, potassium deficits where their blood vessels spasmed. And so it was an acute spasm that clamped off blood flow that led to the stroke or the heart attack. It wasn't actually clogging of the arteries. This is why giving everybody drugs to lower cholesterol is not the answer for heart disease, because sometimes it has nothing to do with cholesterol at all. It has more to do with a vasospasm. And of course, mineral deficit, electrolyte disturbance can create those vasospasms and create that problem. Somebody's asking about nascent iodine, if it's okay to take on a daily basis. Look, for iodine, if you don't have an autoimmune thyroid problem, it goes back to dosing. It depends on how much. Is it safe to take every day? Yes or no. Some people that take iodine at too high a level consistently over time can actually develop goiters. So too much iodine over time can actually lead to a thyroid problem, just as not enough iodine can lead to a thyroid problem. So it's really, Chris, it's hard for me to answer that question with a great degree of specificity, because I've never seen what your iodine levels look like. And so, that's what my advice would be, to get with your doctor have them measure your iodine levels, and then you'll have a good justification for whether or not you need to be supplementing. Okay, let's see here. No, Sammy asked if you had blockage in the left arm, would you still have blood pressure taken in that arm? No, you can measure it in the right arm too. It's just, again, if you have a healthy left arm, and some women who've had lymphadenomas or have had surgeries where they've removed lymph nodes and other things because of breast cancer, you know, it's not a good idea to put pressure on that left arm. We measure on the right side, and that's perfectly okay. It's just if we have a healthy left arm, we want to use that. Somebody's asking, can I eat warrior bread on a candida protocol? And the answer is yes, you can. How should electrolytes be measured and protein be measured? Intracellular, extracellular, the other body fluids. Depends. If we're talking about electrolytes acutely, like the way electrolytes will disturb the heart is you measure them in the serum. So like your serum calcium, your serum phosphorus, your serum sodium, your serum potassium. Those things are generally on a complete chemistry workup that most doctors will run on an annual physical. So in that regard, as it relates to electrolyte in the heart, measuring those things acutely, like acute risk, would be good in the serum, but it doesn't really show you chronic or storage inside the cell. And the best way to measure, like for example, calcium and magnesium long term is going to be intracellular. Now, I like to use lymphocyte proliferation, because it's a functional outcome intracellular analysis. Some other doctors will use red blood cells, for example, to measure calcium, not calcium so much as magnesium. And so it depends. But they can all be used, and they can all be effective if you have. I like intracellular plus extracellular, or in the blood itself, as measuring them both as far as electrolytes are concerned. So that's part one of the question. Part two is, how do you measure protein? Well, you can measure things like serum albumin and serum globulin. These are types of protein. You can also measure total serum protein. You can also measure protein coming out in the urine, so measure to make sure they're not spilling protein in their urine. So those are parts or ways that we can assess protein status in a person. But in addition to that, something called a plasma amino acid test can also be very effective. Plasma amino acid testing measures all the individual bits and pieces that make up our proteins, so the amino acids themselves. So things like arginine can be measured in the plasma, and that can give you a good indicator as to whether or not this is part of the issue or not the issue. Okay. Wow, I think we got it all. I'm about out of time here, so as we close here, there may be a few questions I didn't have time to get to, and if that's you, just shoot them over to us. We want to take care of you, or make sure you tune in next Monday at 6 p.m. Central Standard Time. That's Texas time. That's where I'm at. And for the next episode of Pick Dr. Osborne's Brain. And if you haven't already, make sure you pick up your copy of No Grain, No Pain, my best-selling book. It's kind of our guideline to get started with diet change if you're not working with a functional medicine practitioner. If you're going it alone, No Grain, No Pain is your best bet, going it alone. Two, make sure you go over to glutenfreesociety.org, sign up for our gluten-free survival kit. If you're new to the gluten-free diet, you don't understand it, you're not quite sure where to start, we've got some great free resources for you there, so make sure you subscribe. And also remember, ultimately, at the end of the day, what is our big mission here? What are we really trying to accomplish? We are trying to help 100 million chronically sick people find real answers, right? So every time I'm on, here's what I appreciate from you. Aside from letting me know where you're at, where you're coming from, where you're tuning in from, one of the things I really appreciate from you is this hashtag right here. Save 100 million lives. That's what we're trying to do. There are 100 million people that are diagnosed with some form of chronic illness that's caused by diet and lifestyle, and we're trying to get this information into their hands. So if you can give me that hashtag, save 100 million lives, and if you can share this video with somebody that suffers with blood pressure issues or heart issues, that helps us reach that goal. That's really what it's all about, is helping more sick people find real answers, not simple band-aids or patches that lead them down a road of false confidence and false security, but actually increases their odds at getting sick in different ways. So help me out. Hashtag save 100 million lives. Help me out by sharing, liking, and tweeting, and Facebooking, and YouTube sharing this video so that we can get this message out to more people. This is Dr. Osborne with the Dr. Osborne Brain Show. Hope you have a wonderful week. We'll see you back next Monday, same time.